As we've heard already this morning, we view innovation as the absolute key to solving the impending and pressing problem of sustainability and affordability in the health service. It's absolutely central to all our policies. If you think about where we are today in the National Health Service, the service that we provide is, if you like, an accumulation of innovation that's been brought in over many years. But we shouldn't just think in terms of technology or new drugs. We should certainly also think in terms of the ways that services are planned and delivered and indeed regulated. There is an awful lot of interest, I believe, overseas in what we are doing here in England, in the health service, in trying to drive through innovation. I think in particular of the delivery of primary care services, but also medical training, where we have some world-ranking institutes and universities and teacher training hospitals. Informatics is another area where we are in the forefront. And, of course, hospital design and build, where we are also world leaders. And as you heard earlier on, the bewilderment that some people feel overseas about accessing all of this is something we've tried to respond to in setting up Healthcare UK, which will be, if you like, a kind of docking point for international inquiries and requests for assistance. If you've got any notion of collaborating with the UK or wondering what we're doing that could help you overseas, this unit will put you in touch with the right people, the right know-how, the right partnerships in the UK. Now, what we're hoping to do in this seminar is, if you like, to showcase a bit of the UK capability across the public and private healthcare sectors, the sorts of services that we can offer. And there's a brochure that explains more about that offer on healthcare, and it's on the memory sticks that you'll be, excuse me, you'll be all getting, if you haven't already, that we're giving delegates. So you can access those after the event. Well, now, we've got an extremely impressive array of speakers today. We have, and I'll just introduce them all briefly, and then we'll go into the sessions. First of all, we have Tim Smart, who's the Chief Executive of King's College Hospital NHS Foundation Trust, very large teaching hospital here in London. Stephen Johnson, who's with the Department of Health for the past 4 years. He's been heading the team looking at the care of patients with long-term conditions. Miles Ayling, who is the Director of Innovation and Service Improvement at the Department of Health. Dr. Andrew Vallance-Owen, who is a trained surgeon and until recently was Group Medical Director of Bupa. Paul Kalkhoven, who is a Senior Partner at the architecture practice of Foster & Partners, a very well-known international practice. And certainly, last but certainly not least, someone who you heard from earlier, Dr. Oliver Harrison, who's the Director of Public Health and Policy at the Health Authority of Abu Dhabi. So I think an interesting and rich range of topics that we're going to cover. So each of our speakers are going to give a short talk, and then we're going to open the floor up to question and answers at the end. So if I can first of all call upon Tim Smart, Chief Executive of King's College Hospital NHS Foundation Trust, to get the ball rolling. Tim.